With October being Breast Cancer Awareness Month, women are reminded to make sure they are getting their annual mammograms.
And for some, they might discover they have dense breast tissue. So what does that mean, and is it a cause for concern?
Essentially, dense breast tissue refers to the amount of milk ducts and connective tissue in the breast. And the reason it's important with respect to screening for breast cancer is that dense breast tissue, or the connective tissue in the milk ducts, show up on the mammogram as white.
And Dr. Laura Dean is a diagnostic radiologist for Cleveland Clinic. She says since dense breast tissue shows up as white on a mammogram, it can make it harder to spot the breast cancer. That's because breast cancer also shows up white. Self-checks at home can also be challenging since dense breast tissue tends to have more lumps and bumps.
And Dr. Dean says dense breast tissue is very common in women, and in some cases they may need additional screenings like an ultrasound or a breast MRI. However, that's up to the doctor to determine, of course.
The other part that we're learning more about is how having dense breast tissue can increase your risk of breast cancer a little bit compared to women who don't have dense breast tissue. So women who have the most dense or the extremely dense tissue are about 4 to 6 times more likely to develop breast cancer in their lifetime compared to someone who has really fatty breast tissue.
Breast cancer is the most common cancer for women in the United States. Aside from skin cancers, it's also the second leading cause of cancer death in